Hi, it's Dr. Brett with Ask Dr. Brett. Hey, a lot of people have asked me and sent questions in. Tell me the story about podiatric residencies. You know, some people do different amounts of time, people do other amounts of time. What is it? Can you explain it for me? Let me give you the short of it. Many, many years ago, when the advent of medicine started, doctors used to cut your hair. You know, your general surgeon is originally a barber. That's why the red and white pole was the blood sheets wrapped outside the saloon in the old Western days. Medicine has moved forward, there's been more formalized training, and that's gone in every aspect of medicine. Podiatry originally started as chiropody. That's back in the 50s. Chiropody were people out of high school who did a little work and took care of people's feet, corns, and calluses. Obviously, the need and the growth was tremendously greater than that. They moved on to go to school, to go to medical college, to go to medical school, to get licenses, to write prescriptions, to be able to operate, to go into hospitals. Now, once you graduated, you went to a hospital. The hospital wanted to make sure you knew what you were doing. Well, in the 60s and 70s, there was only a few podiatric residency programs in the country. And these were highly sought after. So probably 80 or 90% of people didn't get residency training. They got on the job, they worked with a neighbor, they went and flew out of town and spent time with another doctor. They learned on their own, but it wasn't formalized. A lot of these people who became really good surgeons in the 70s, let's say, and early 80s, who didn't have formalized training, as political hospitals started to allow podiatrists to operate, they started to create residency programs. The residency programs then took people out of school, and they did 1 year, 2 year, and now 3 years of residency training just doing foot cases. But who taught them? The people who taught them often were the doctors who were not doing residency programs. Today's day, in today's residency programs, doctors, the faculty at a residency program is the orthopedic surgeon, is the neurosurgeon. It's every aspect of medicine that's taking care of these people. Putting it all together, somebody who's done a residency program at a veterans hospital is probably very familiar with diabetic wounds and trauma and some things that go into those areas. Probably isn't as sharp on taking care of your kids' feet. Because, you know, how many kids are veterans? Let's be serious. Now, each one of those veterans programs does make some arrangements with some institution somewhere so that the residents get some training in pediatrics, but others don't. You want to go to a place, you want to go to a doctor, you want to go to somebody who has the most training, and depending on what you need. If you're going to somebody, you have a sprained ankle, and you walk into the waiting room and there are 7 wheelchairs there, might not be the doctor you want to see. You want to see somebody who has a young and active practice. They're probably treating more ankle sprains. Doesn't mean somebody can't do everything, and it doesn't matter. In my practice, I'm in Boca Raton, Florida. We have people who are over 100 years of age, and we have people who are just born babies we take care of on a daily basis. So it's unique. You want to find somebody who feels comfortable, makes you feel comfortable, explains everything, and of course has the credentials you want. I did 2 separate residency programs. I did 1 year in orthopedics in Philadelphia, and then went and did a 2nd and 3rd year out in Salt Lake City. And I did this when most people did maybe 1 year of residency training. So there's, but I was taught by people who had no residency training, who I look up to as great doctors. So what you want to look for is somebody who has the experience to do what you need done. And if you're not getting results, a second opinion is never a bad idea. Again, I hope I answered your question. This is Dr. Brett Robotsky with Ask Dr. Brett.